let's jump right in. Today, we're talking about something really special, the world of special needs dentistry. Now, this is a field that goes so far beyond just cleaning teeth. It's really all about deep empathy, incredibly careful planning, and adapting care to fit the unique needs of every single child.
I mean, just think about it for a second. A regular dental visit can be tricky for anyone. But what do you do when you need to get a clear X-ray from a child who, because of their condition, simply cannot stay still for even a moment?
Or picture a child with sensory sensitivities. For them, the bright lights, the strange sounds, the whole environment of a dental office can be completely overwhelming. Well, these are the exact kinds of real-world problems that special needs dentistry is designed to solve. So let's start by digging into what this field really covers.
So what exactly is special needs dentistry? Well, at its heart, it's all about understanding the individual first and then building a completely customized care plan around them. It's a philosophy of adaptation, not expectation.
So there's actually an official definition for this. The American Academy of Pediatric Dentistry, or the AAPD, calls it special healthcare needs. And this is a really broad term. It covers a huge range of conditions, everything from physical and developmental to cognitive and emotional, that all require a more specialized kind of healthcare.
Now, to help break it down, these conditions usually fall into two big categories. On one side, you've got developmentally compromised conditions like cerebral palsy or autism, and on the other, medically compromised conditions, which includes things like heart conditions or hemophilia. And making this distinction is super important because it completely changes the kinds of precautions and adaptations the dental team needs to make.
But, getting this kind of specialized care, it's not always simple. Families can face some really big hurdles. Of course, parental anxiety is totally understandable, but sometimes it can cause delays in getting care. It can also be tough just finding a dentist who's trained and comfortable providing this care. And then, of course, there can be financial barriers. It's why understanding this field is so important.
Okay, so here's what's really fascinating about all this. A huge amount of the work happens before the child even sits down in the dental chair. Success is all about the prep work and building a real partnership with the family.
It all kicks off with that very first phone call. A well-trained receptionist asks the right questions to make sure plenty of time is booked. Then comes a detailed screening to get all the information, the diagnosis, medications, the child's doctors. From there, the team plans out that first visit down to the last detail, like scheduling a morning appointment for a child with diabetes to make sure their blood sugar is stable.
And it's not just about the people. The physical space has to be ready too. We're talking about things we might not even think about, like making sure doorways are wide enough for a wheelchair. Having equipment that's mobile, like X-ray units, is also a huge plus, because it lets the team bring the care to the child instead of the other way around.
All of this incredible preparation leads up to the actual appointment. And here, the number one priority is, and always will be, safety. Safety for the child, for the parent, and for the dental team. And this requires some really thoughtful, ethical ways of managing behavior. So that brings up a really important question, right? For a child who just can't cooperate, maybe because of involuntary movements or really severe anxiety, how does a dental team make sure everyone stays safe while still delivering the care that's needed? Well, the answer is a technique called protective stabilization. Now, it's really important to be clear about this. This is only used when it's absolutely necessary to prevent someone from getting hurt. It's a tool for safety, not restraint, and it's only ever considered after other techniques haven't worked. And most importantly, this is the absolute key. Informed consent from a parent or guardian is a non-negotiable requirement. It has to be given, and it has to be documented. So, this all brings us back to that core principle. There is no one-size-fits-all here. The care plan has to be totally customized. And to show you what this looks like in the real world, let's compare how a dental team would manage two very different conditions. First up, let's take a child with cerebral palsy. Here, the challenges are mostly physical, right? So the team focuses on things like stabilizing involuntary movements with head supports or pillows, keeping the patient's back a little elevated to help with swallowing, and using something called a rubber dam to prevent aspiration. The whole game is about physical support and being efficient. Okay, now let's compare that to a child with hemophilia. In this case, the main concerns are all about medical risks, specifically bleeding. The entire playbook just flips. Before anything happens, the dentist has to talk to the child's hematologist. Certain injections and even common pain meds are completely off the table, and the team will always choose procedures that minimize bleeding. It's a totally different set of rules. And seeing how intense and customized the treatment is,
Well, it really drives home why the ultimate goal is actually prevention. Because, the best dental procedure is the one that never has to happen at all.
And this is why it matters so much. For a child with special healthcare needs, going through something like getting a filling is way more challenging and stressful than it is for other kids. So having a really effective, proactive prevention program isn't just a nice idea, it is absolutely essential.
And prevention starts right at home. Dental teams work to empower caregivers with all sorts of practical tips. It could be something as simple as changing a toothbrush handle to make it easier to grip, using an electric toothbrush, or learning safe brushing positions, like the knee-to-knee technique. These little changes can honestly make a world of difference.
And it's not just about brushing, it's a real team effort. Any advice about diet is always coordinated with the child's doctor. Then, in the dental office, professional care can include things like protective sealants, fluoride treatments, and, this is a big one, more frequent visits. For some kids, coming in every 3 or 4 months for a checkup can be the key to stopping big problems before they ever start. So, if there's just one thing you remember from all of this, let it be this. The whole philosophy here is that you don't make the child fit the care, you adapt the care to fit the child. It's about bending and shaping every single thing you do to perfectly match their unique physical, emotional, and medical needs.
And that kind of leaves us with a final thought, doesn't it? This model of deep listening, careful planning, and radical customization, it's incredibly powerful. So the question I want to leave you with is, how can we take these lessons we've learned from special needs dentistry and apply them more broadly to make all kinds of healthcare more empathetic, accessible, and effective for absolutely everyone?